What do you tell people on day one about exercise?
Yeah, when I see a new Parkinson's patient, it's often hard because, especially if they're not expecting it, and some people aren't.
Yeah.
I don't know how much they actually take in. Some people are prepared for it. You know,
Mhm.
they've done some research. They're like, "This is what I've got." I mean, I've got a lot of very, very intelligent people that come into me, and they've already made their own diagnosis, and I'm just confirming it.
Mhm.
But then I have those other people that their PCP saw something, and they haven't really noticed anything yet. And yeah, this is just
Yeah.
for some people a nightmare because they weren't expecting anything at all.
Mhm. Yeah.
I get a lot of misdiagnoses too, where they get called essential tremor, which is a lot better than hearing something like Parkinson's disease, which seems a lot more scary.
Yes.
Um,
Yeah.
but generally speaking, if I can talk to them and they seem like they're really taking things in, exercise is a huge component of that initial visit and what I talked to them about in terms of their treatment plan. We have a lot of brochures and things about different types of exercise opportunities, but I tell them they need to push themselves. That moderate to intense exercise a couple times a week is good for them. They need to find something that they can safely do and that they can enjoy and keep up. And a lot of times we'll order physical therapy even on that first visit. And I really emphasize that if you don't keep up those exercises, the benefit is not going to last forever, and you're going to be back to where you were.
Yeah.
Um, we also have been talking a lot recently about virtual exercise just because of the COVID-19 pandemic.
Yeah.
And I would just tell your listeners, if you Google Parkinson's disease and exercise in any search engine, you're going to see a ton of stuff come up.
Mhm.
Dance for PD is something. I know you guys have the Parkinson's Gym,
Mhm.
the Michael J. Fox website, and the Parkinson's Foundation website also have a lot of virtual exercise opportunities if people are interested in that. Hopefully, we're fully able to get back in person. I know right now our community is probably out more than the medical center is because we're still
Yeah.
being really cautious. Um, but you still need to be careful in large groups. I would really encourage people to be outside as much as they can, if
Mhm.
they can. You got to exercise. You got to keep it up. You got to find something you do. You need to push yourself if you can do it safely. I think those would be the big things.
Okay.